Last two questions. You threw out a very big statement towards the end of your intro of the podcast where you say that healthcare will change dramatically in the next decade. Why do you believe that, and where do you think that we're going to see it change the most?
Well, so it was when I recorded that, this was probably December when I actually wrote that and recorded it. So 6 months ago, I want healthcare to...
You were omniscient. You knew what was going to happen in healthcare, I guess.
Well, so because of the inefficiencies that happen in this market, it was more of a hopeful statement that I really hope healthcare changes dramatically over the coming decade. And I gave it a decade because, normally in a market with the inefficiencies that we have in healthcare, if this was a more kind of customer-focused market, it would change a lot faster than that. But I gave it a decade because I'm like, healthcare moves slowly. We're probably not going to see the change that we all want very fast. But the pandemic has dramatically accelerated that change. I think it's exposed the parts of healthcare that people have been saying are broken for a long time. Access to care, rural care, not adopting technologies that everyone knows is obvious, like virtual care tools, telehealth type solutions. So those things are things that were exacerbated by the pandemic, and the need to adopt them became so high that we saw health systems turning on telehealth products that, in a normal time would take them a year or 2 years to implement and roll out pilots and test out in different areas. They turned it on overnight, and then they saw, 100x increase in telehealth visits. And so that's the change I'm talking about. We're going to see a fundamental change in how care is delivered, and that change is going to be driven off of technology enabling it. So it'll be technology-enabled change in our healthcare delivery models. And, like everyone's been saying, telehealth we're not putting that genie back in the bottle. It's been implemented. Patients are starting to get used to it. 80% of patients who had their first telehealth visit over the past few months in the pandemic say that they would like to do it again, according to a recent survey that was put out. Doctors are getting over getting out of the status quo and learning how to use it and understanding that they can see patients effectively for certain types of things over telehealth. So we're going to see that settle down over the next 6 months or so, and the telehealth programs will become more established. But then they're going to start adopting tools that really are complementary to telehealth, other virtual care solutions, remote diagnostics, remote patient monitoring, anything that happens outside of the four walls of the health system. And it's pretty clear right now that the healthcare organizations that took risk on patients, the ones that were deep into the transition to value-based care, the ones who were paid on a capitated rate or had a payer as part of their organizations are surviving more effectively during this economic downturn that's caused by the pandemic. So hopefully we'll start seeing more adoption of value-based programs. And with the adoption of value-based programs, that means more incentives to figure out what's going on with patients outside of the four walls of your organization, because you're at risk on that patient's life. And what that means is technology is so suited to do that. And your traditional EHRs aren't really in a place to help you out with that. So I'm expecting a lot more adoption of tools that will help healthcare organizations focus on how do we take care of our populations and make sure that we can track them and intervene so people don't end up a high cost, poor health situation that causes a lot of the costs in the system. So that's the reform that I hope we'll see. And I thought it would take 10 years, but I think it's going to be over the next 2 years now as we pull out of this recession and healthcare organizations figure out how to generate revenue again.
Got it.